Hi, my name is Dr. Aditya Mangla. I'm the Chief of Cardiology here at Jamaica Hospital Medical Center, and we'd love to talk to you a little bit during American Heart Month about things you can do to keep yourself heart healthy this month and going forward. I like to break things down into things that you can modify and things that you have to work on a little bit more that you can't modify necessarily. Out of the things that you can modify, the three big ones that I like to talk to people about are your smoking, your diet, and your exercise regimen. So in terms of smoking, if you are a smoker, obviously we advise you to quit. And that goes for whether you're smoking cigarettes or vaping or any of the other sorts of things that people do. There are certainly a lot of resources in New York to help you quit and something that you could talk to your primary care doctor about. Secondly, in terms of diet, I think people have a general idea of what a good diet is, but you want to stay away from things like trans fats, lots of fried foods, and even things that are heavy carb meals in large quantities. So you want to stay away from those. Generally speaking, things like lean meats and lean fish are things that you want to keep in mind, as well as obviously green leafy vegetables. The last thing that we'd like to talk to you about in terms of things you can modify is your exercise regimen. Generally speaking, we recommend at least 150 minutes of moderate exercise a week or 80 to 90 minutes of more strenuous exercise. We understand it's difficult sometimes to incorporate exercise regimen into a busy lifestyle, but it's critically important to keep your heart healthy. We do want you to do something every day to keep that body moving. Those are some things you can modify. Things that you may not be able to modify as well are things related to your genetics. So if you have a family history of a heart attack or stroke, certainly something that you want to talk about with your primary care doctor or cardiologist. Other things that you want to keep in mind are diabetes. If you are a diabetic, making sure your sugars are well controlled. If you have a high blood pressure, then making sure your high blood pressure is controlled, as well as your cholesterol. And doing all those things in conjunction with your doctor will keep you controlled, have you heart healthy going forward, so that you can spend lots of good years for yourself and for your family. In order to do that, if you need to make an appointment with your doctor, we'll leave some information for you, and we wish you all the best. Thank you.